Thank you for staying tuned. CareGivers, an international non-governmental organization, has donated $36.5 million to Nigeria and other 15 countries to help eliminate trachoma, a bacterial eye infection that can cause blindness. The country director for CareGivers, Dr. Joy Shuaibu, made this known in a statement on Thursday in Abuja. Shuaibu explained that trachoma, a neglected tropical disease, causes severe pain and impairs daily activities like earning a living and caring for families. This funding under the Accelerate program aimed at eradicating trachoma by 2027 will support select African countries in their efforts to fight the disease, including Nigeria. The Accelerate program, funded by international donors like the Bill and Melinda Gates Foundation and the Children's Investment Foundation, has previously helped the Republic of Benin eliminate trachoma in 2023. And to unpack this, I'm joined by a consulting optometrist, Vision CareGivers International, Dr. Egharevba. Good evening. Glad to have you join me.
Good evening.
All right, let me start by asking, what's the prevalence of trachoma in Nigeria and how has it affected public health?
Okay, trachoma, there are two areas that it's spotted for its prevalence. For its effect, which we call trachiasis, where lid is impacted, comes over. We have about 0.6%, about 17.6% prevalence. And for the active trachoma itself, we have about 5 to about 45% active, that's the prevalence in Nigeria. Its effect is quite devastating in terms of the individual going through the experience, because we know that for every person who is affected, when it comes to blindness, it goes a long way to affect everybody in their household. Like I usually say, when one person goes blind, 3 people are affected in that instant. The person who goes blind, the person is going to support the one who goes blind, and another person who has to support the one who supports the blind person. So it has great impact for the family, and its influence in Nigeria. It's generally the condition affects people with poor living condition, sanitary condition, it's poor, it's high.
Dr. Trust, apologies for interjecting. We're having difficulties hearing you clearly. If you can make do without your earpiece, that would be fantastic.
Now?
Okay, carry on,
Can you hear
Trust.
me?
Yes, much better.
Okay.
Yes, you are sharing insight regarding the prevalence of trachoma in Nigeria and how this can lead to blindness.
Okay. So, like I said earlier, we have about 0.6% to 17.6% prevalence of trachoma. Trachiasis, which is a condition that is caused by trachoma. Active trachoma, we have about 5% to about 45% prevalent in Nigeria. The condition actually comes or spreads because of poor sanitary condition that enables the spread of trachoma, which is a bacterial condition. Just is a simple way, touch. Once there's contact with it, whether someone has used a handkerchief that has the discharge from the eye, the nose, the mouth, because there's a direct connection for connecting those 3 places. So once the eye is infected, if someone gets a fluid from the eye, maybe tears or sputum, that's from spit, or from the nose, that could be infected. And whatever that thing has touched, when somebody else touches that thing and touch their eye, the infection spreads. Okay, its effect is gradual, but can be it can cause excruciating pain because the eyelid, you invert the eyelid or you turn your eyelid upside down, that part, it can make them scarred. Okay, just like you have a scar on your skin, the skin is no longer even, it's rough. And that could begin to rub on the transparent part of the eye, which you call the cornea, and makes it cloudy. And that cloudiness is the part that causes blindness for the individual.
Now let's talk about funding, Dr. Trust. I mean, what funding specifically, how would this funding exactly help Nigeria address this disease of trachoma?
Yes, the funding goes, if we go to the statistics from 2019, we can know that about over 62,000 people were helped from surgical intervention, and close to over 9 million people were helped in terms of the supply of antibiotics to help combat the condition. Okay, so that funding, we know currently healthcare is getting more expensive due to economic changes, and that funding will go a long way to help the supply of antibiotics to environments that are already infected, that has high prevalence rates. And also for surgical intervention and for sanitary intervention, provision of clean water and sanitary condition is very important. I think that fund will go a long way to help in these areas, very importantly. Now, so once we have proper water supply, we have sanitary conditions improved, we have supply of antibiotics, and when needed, surgical intervention.
Now, let's talk about prevention. You've talked about, the hygienic sanitary environment, surgical intervention, but then prevention now. How can one guard against not contracting trachoma? What are the lifestyle habits one should adopt, in order not to get trachoma?
Okay, the first thing that you have, is simple to do, and it's available to everybody, is hygiene, proper hand washing, and also we have facial cleaning. Wash your face, wash your hands. Those who are in those areas that are predisposed, there's evidence rate of trachoma, hygiene is a topic. That means wash your hands regularly. If you are a caregiver, you are a mother, you are attending to your baby, make sure you wash your hands properly. And as much as possible, reduce the incidence of hands going to your eye. Okay. Then secondly, we talk about cleanliness in the environment. There's a fly that is actually attracted to the eye and spreads the condition a lot. So if you can reduce things that will bring flies around, it will help a lot. Babies, children between the age of 4 to 6 are more of the reservoir of this condition, and women tend to have higher incidence of this condition because they have the. So once you have the environment clean for a child, you are saving both the child and the mother as well.
Because
so
of our
cleanliness in the environment, personal hygiene is a go-to for preventing this condition.
Let me quickly move to treatment options because of our time, and I still have a couple of questions for you. What treatment options are available, and then do they have any side effects?
Okay, there are two areas of intervention, medical intervention. One is antibiotics. So when someone detection is very important. So once it's identified, the person goes on antibiotics that can help to stop the condition. And very importantly, you have to prevent second reinfection, which causes the condition to complicate. So antibiotic intervention is one medical approach to solving it. And the second one is where the case becomes critical, that causes the eyelid to evert or to turn over. You need surgical intervention to put that or correct that. So those are two, according to WHO standard, those are the two medical interventions that can be put in place. Then talking about effects, I mean, we talked about side effects. The antibiotics are great. They have a duration of work, and it's excellent. It's a specific antibiotic that is prescribed for this purpose. It has been doing great job. Like you mentioned earlier, success rates in Benin Republic and other places have been recorded with this approach. And I believe it's going to be of a positive impact for Nigeria as well.
And
It's going to be great. The antibiotics will going to work fine, and everyone will be.
And that's a fine place to wrap up. Thank you so much for your insight on the news, Dr. Trust Egharevba, consultant optometrist. Thank you once again.